Namaskar and welcome to Apollo 24/7's Health Hour. This is a weekly show where we bring you experts from Apollo hospitals. Direct to this live show where you can ask your questions and queries. We will bring you a live answer. And today is the first episode of the year 2023. And welcome to the show. Happy New Year, Healthy New Year to all the viewers. चलो आज शुरू करते हैं बात करना फर्स्ट एड के बारे में. हेल्दी रहना, डिसीज को मैनेज करना, दिस इज ऑल एट वन लेवल. बट to have a safe and a surroundings environment safe रहना भी बहुत important है. छोटे छोटे जो घरेलू एक्सीडेंट्स होते हैं, इंजरीज होते हैं या स्प्रेन्स, बर्न्स, कट्स, let's understand how to treat them. What is first aid? Why is it important? आज हम आपके लिए एक्सपर्ट को लाने वाले डॉक्टर कमाल अहमद जी, who's a general physician consultant in general medicine. He is going to join us. And Dr. Kamal Ahmed साहब 23 years plus experience है इनका. We can consult him for hypertension, diabetes, infections, common cold and cough, minor accidents, asthma, headaches, etc. And he can be consulted on Apollo 24/7 as well. And he practices at Apollo Indraprastha Hospitals, New Delhi. तो चलिए आज उनसे मिलते हैं और आपके क्वेश्चंस भी आंसर करेंगे. ये लीजिए डॉक्टर साहब भी आ गए. गुड मॉर्निंग डॉक्टर, वेलकम टू द शो.
Good morning and Happy New Year to you all and the viewers of 24/7. Thanks, Laxmi ji, for inviting me on this forum.
Wonderful, doctor. Having you here on this first episode of the year is really exciting. I got really very excited as a child. School mein, I used to be a guide in the Scouts and Guides program. So first aid was very important, and I used to very actively participate as a child. So it literally took me back to my school days and nostalgia. And I was thinking, did as much as I was paying attention to first aid in my younger days, am I a little lenient now? Have my priorities changed? Are my first aid concepts up to date? ये questions मैं खुद को पूछ रही हूँ. And what do you think is the importance that we need to give to first aid? How important is it?
Well, obviously, first aid are the aid. Basically, we define it as like it's the aid given to a person, sick person, or concerned person before landing in the hospital.
Ji.
Right. So the importance of first aid is too much. So first, if timely intervened, it can save the life of the person. If
Absolutely.
it can protect or reduce the harm to a person, and like it can reduce the pain before shifting the patient to the hospital. So first aid is really important, and it's the aid we give. It can be at home, it can be on the roadside, it can be in the airport, aircraft, train, anywhere. So the
Yes.
initial judgment of a person is important, and the concept of first aid, apart from what we have minor illnesses at home like cuts and all that, how to manage this, and the serious part of it, like you have an RTA accident, and then you have poisoning, electrocution, burns, all these things. Like how to approach and how to react to different situations. That is
Absolutely.
what all. Uh,
Yeah. Yeah.
yeah,
So
that
can you
that
now
is all.
aggregate these two? One, gharelu accidents or home accidents, which are not major in nature, and the ones that you see that you have to react, but you don't know how to react. The major accidents and first aid. Let's segregate these two and talk about the fundamentals of first aid.
That's right.
So,
See,
yeah.
like the first aid, what we experience most of the that's the common one at home. Like you can have a cut, you can have a fall, right? So you slip down, have a fall, and especially elderly, the risk of fractures, major fractures are very high. Then
Yes.
cooking in a chin and all that can cause some sort of burn and all those things. So these are the common one. And then you have persons at home who can have a chest, acute chest pain, the heart attack, what we call.
Yes.
Then you
Yes. Yes.
have a stroke. Anybody who's above 60, the risk is very high. So anybody can have a stroke, so, which requires an immediate attention. So
Okay.
like obviously, even at home, things would vary. The spectrum would vary. Like for the
Correct.
minor element, you
Serious भी हो
have a
सकता है.
small, yeah. Until the serious issues like the heart attack, the stroke part. So the person has to be little vigilant and to recognize how to deal with in that situation before reaching the emergency room or the hospital.
True. So let me ask step by step
Yeah,
fundamentals of which are not serious. You know, जैसे आपने बोला है कि emergency situation में first aid, I'll take it
right,
later. But let me
right,
start from home. Then I will go on to the roads or any other places, public places. May accidents I'll take
right.
later.
Mhm.
So at home also, I'm going to start with non-serious, non-medical attention wale, and then later we'll go to an emergency situation. तो घरेलू जो एवरीडे एक्सीडेंट्स होते हैं, जो जैसे आपने बोला है कि कट्स हो सकते हैं, बर्न्स, माइनर बर्न्स होते हैं, या एनीथिंग विच कैन बी अ स्मॉल sprain or strain. We know the reasons that can cause, but how do we quickly treat them?
Well, like depending, like you if a knife cut or anything, depending upon the seriousness, you can judge the extent of the cut and the second the bleeding part. The instant would be you wash it, clean it, all the debris should be out, and then wrap it to prevent the bleeding. You can wash it with water, plain water. You can wash it after that with some antiseptic if you have like Savlon or something like that, Betadine, Savlon. Normally, people at home has one or the other antiseptics, and then you can apply a clean bandage. You can apply a clean cloth and wrap it and go to the hospital for further management. The bleeding has to stop after cleaning the wound. That is the idea.
Yes. So,
Similarly, if you have a
while
burn,
you're saying all of this, doctor, so I'm trying to understand that what are the things, going back to the fundamentals of having a first aid kit at home. It's not just the box that I need to have. I need to
right,
know what's there, and the basic things that I can have to, कुछ भी cut हुआ या bleed हो रहा है. So we need to have the basic things in the box. What are these now for the cuts and
right.
injuries?
So, like you have one some antiseptic, like the Savlon, which helps in cleaning. Then you have the band-aid and other structures and like the bandages and those stuff where in case of cut that can be used. That's all is required. The second would be depending upon the who are the persons who are living in the house. Somebody who's diabetic would require something different. Somebody of elderly who already in known case of cardiac disease would require a tablet of sorbitrate or
And
something which should be given
and
immediately.
children.
So yeah, then children has to be like tackled in a different way depending upon the kind of problem they have, right?
You know, especially children, especially toddlers who are running around India and most of the part of our Southeast Asian
Right.
countries. We have
Right.
corners, we don't have child-proof homes. So
Very
we see
true.
injuries
Yeah.
very often. How does a
Right. They
parent
are
react to the situation?
yeah. So they are prone to get injuries. They are prone to get like things are accessible. They swallow things at times, medicines of elderly or things like that.
Yes.
So apart from preventing, trying to prevent all those stuff, but as you said, in India or the Southeast Asia, this most of the time is difficult for the parents to manage all those things. So obviously, we need to see the extent of the injury, like whether the child is conscious, active, breathing normally, everything is okay. So you have a time. Probably the impact of whatever happened to him is not that bad. So first you have to see how active is the child, his
Ji.
conscious level, then whether he's breathing normally or not. Is he distressed? He's not able to speak. At times with
हाँ,
the severe choking, the breathing and the speech gets affected. So that has to be tackled accordingly. And obviously, if you feel at any moment in the initial judgment the impact of problem is severe, before doing anything you must call an ambulance and then or a medical help and then start doing all those stuff. So that
yes.
judgment totally depends upon you. You can judge like somebody who is just a small cut. You may not require to call an ambulance. You like can reach hospital yourself. After doing the basic first aid treatment, you can reach the hospital and see the doctor whether you require a stitch,
Yes.
anything else to be done, and all those stuff. but somebody who's unconscious, fallen down, not responding. So before judging, must call for a help and start doing whatever at that time is required. We will
Yeah.
discuss in different scenarios that how to go about that.
Yes. So the first thing in a first aid response is judging. How well do you
Yeah,
judge the situation would be the first
exactly.
aid that you can give.
That would be the first thing you have to judge the scenario, the impact of the problem, like how dangerous is the event which happened to a concerned person. That is the most important thing you need to judge, and
Yeah.
accordingly you have to react.
Great. So great. While I'm seeing the YouTube chat questions, Mr. Krishna Kittur, good morning, sir. How are you doing? Happy New Year to you. He's a very regular participant on the show. So Krishna ji पूछते हैं what to pack in a medical kit for a family who is going to travel in India and abroad. See, this is a very important question, which is a large question, which opens up debate to carry your own medicines. Apart from those, other countries may first aid becomes really medical expenses become really difficult. So, what do you
Right.
suggest?
So, well, this is a little vague question which contains a lot of things that
Yeah.
again basic kit like it can contain a lot of bandages, it can contain a lot of band-aids, simple user friendly these days. You have a lot of better ones which can be easily kept and applied, and then a cleaning process of all those things like antiseptics and all that can be kept in a bottle, and then something for pain and something for like those who suppose somebody is a known, there's a lot of people who are had an anaphylaxis reactions to the sting bite, bee bite, and all those things. So they're usually they are usually aware and they have an adrenaline injection. So those depending upon what are the issues with certain people, which can be serious on move or when they are traveling. So they
Yes,
should
sir.
be keeping with them because
Yeah.
I know few people who are had a serious allergic reaction, life-threatening serious allergic reaction to the sting bee bite. So they always carry an injection of adrenaline. In case of any bite happening, they have to use that adrenaline immediately. So those
Yes.
things would be a first aid and would be life-saving.
Great.
Somebody
So
who
while
is a diabetic,
talking about
so
travel and Mr. Krishna, as far as I remember, is always concerned about diabetes. So once I was in an airport waiting for the flight, my co-passenger suddenly slipped out of consciousness. I could see her going slow down, and then she lost her consciousness. By the time the doctor came and checked, and it was hypoglycemia. आई कुंट
okay,
रिएक्ट आई वाज थिंकिंग इनको कुछ हो रहा है या कुछ हार्ट अटैक है या ये क्या है सो डायबिटिक्स एंड हेल्थ इमरजेंसीज हो सकते हैं कहीं भी स्पेशली ट्रैवल में
G.
हाउ डिड what should have been my first response I am still puzzled of I couldn't help her in any way so
Okay. So like these things happening at a place like you are sitting in an airport next to her. So you should
stranger
have
है
asked, are you having any medical disease or are you taking any tablet? If she would have prompted you like, yes, ma'am, I'm a diabetic, so we can presume she's on
right
medication for diabetes. So most of the time in diabetics, the idea is just for a first aid, we keep it simple. Whenever you see a patient who's becoming unconscious or drowsy, we
all
have to suspect hypoglycemia first and should be treated immediately. Like the
so
treatment is
hypoglycemia
simple
is low
and
sugar
low
common
sugar.
भाषा में
Usually,
sugar कम हो
yeah,
जाए
sugar कम हो जाती है because what happens, they usually take the tablet during travel, the diet and other things may not be that good. So they have a tendency to land up in hypoglycemia, that is the low sugar, which can cause them drowsy, unresponsive. And if you would have asked her like she's a diabetic, so you would have thought something of that hypoglycemia, low sugar, and she would have taken some juice, some sugar, water, some chocolate, and these people should keep with them all this stuff. So she would have that hypoglycemia would have avoided, and especially the low sugars usually damages the brain if it is there for
Oh,
longer time. Because
oh.
yeah, at airport you may not get that medical help that fast, like giving IV dextrose injections and all would take might take time by the time you alert the medical system and all that. So that's what I initially said. The first aid is important because that time factor it reduces.
Absolutely, and that was a great suggestion. So, what in case the it is not a low sugar situation? What in case the
Case
sugar shoot
it's
up?
not sugar, low sugar. Suppose if this happens with a 300 sugar, but
Huh.
you have to presume because you have not checked. You can presume raising a sugar from 2 to 300 to 400 by giving something from outside will not harm. So
Acha.
any diabetic on medication or on insulin becoming unresponsive, the first would be to consider it as hypoglycemia, as a low sugar, and treat with whatever sugar sweetness you have around. Even if the sugars are high, it's not going to make any difference in the long run.
So,
But
how
if
long
it's
will
low,
the person to recover in such scenario, doctor? And what are the symptoms that I need to watch out for?
well,
Recovery may
that the
take. Yeah.
progressive loss of consciousness, drowsiness is important. Her overall look, sweating, palpitations, pulse rate, BP, those things would get affected once somebody would be drowsy. But normally, once you start treating, like giving sugar solutions or juices and chocolates, like those things, or if the person can take some meal, so things would improve,
Okay.
right? And meanwhile, once you started doing these things, you must bring an ambulance or nearby medical help. That is important. By the time you have done five
Yes.
minutes of all these things, somebody arrives from the medical team. They will check the sugar, put the IV, and everything. They will take over. So in that case, the
Absolutely.
time factor is important, and probably you have saved the major hypoglycemia, damaging the brain. So that is the role of
Absolutely.
first aid,
Okay.
the time
In
factor.
diabetes, yes. So
Yeah.
always remember, judge the situation and reiterating that ambulance or first aid के लिए जो भी आप कर रहे हो should be followed by a proper medical supervision. That is nationwide 102 is the ambulance number. In Telangana, Andhra Pradesh 108 also serves and 1066 Apollo आपके साथ होगा 1066 in all emergencies and traumas. So let me continue with another question. घरेलू accidents में sprains and falling, injuries to the bones or injuries to the muscles. So sprain, strain कैसे समझ आता है कि क्या हुआ fracture कैसे identify कर सकते हैं? What can be done?
Okay. Suppose somebody who was doing some work was physically okay, had a fall from the stool or something in the kitchen. So, depending upon the pain, the limb movement, and all that, you have to judge, right?
जी.
If there is any cut and all that, so you need to clean that cut. If there's a bleeding, you have to properly do a pressure bandage. And then, if you feel the pain is severe, presume it as a fracture and take a medical help. If the person is
Yeah.
not in a position to go, ask the ambulance to come and then transfer him. The rest of the
So
things can be
fracture
done with
identify करने के quickly
fracture
doctor how do we
identification. Yeah,
yeah.
fracture identification, like would be the pain would be very severe and the limb movement would be very painful, or the concerned limb may not move. Like you, if you somebody fallen down and a fractured hip of the femur, the leg, it would have a severe pain and he cannot be able to move the leg. That is one thing.
Okay.
So
Yeah, and touch
even
maybe if I remember my childhood
maybe one
first aid,
yeah,
you cannot even touch the site.
that's
The pain
the
would be
area.
severe.
So the pain would be a marked thing. And suppose if there's not a even not a fracture, it's a major sprain, you presume it is as a fracture and reach the hospital with the medical help. They will judge after seeing. So in that case, you are going to keep the limb in a stable condition. That is the idea.
So that is the in case of fracture that you can't do much, stable कर दो और ambulance को बुला दो
Ah,
या reach them nearest medical help. What if it isn't a fracture? What if it is a sprain? तो घरेलू first
Even
aid क्या हो
even
सकता है?
for sprain, you can judge. See, the major sprains are to be treated in a little serious way. At times, it can require a plastering or immobilization and all those things. It may require a injections, tablets for pain for longer period. So a major sprain and fracture should be treated in a similar way. The minor
Okay.
sprain, you can judge somebody who's fallen, has a little pain, the movements are okay, and you're not seeing any that what we discussed. The first thing you also told, the judging a person would be important. The
Correct.
giver, the first aid giver should judge the extent of the damage. That is important.
Yes, yes. So, if I remember the RICE, rest, ice compression, and elevation, would you, is that called a first aid at home or before reaching
You
hospitals?
mean to say the cardiopulmonary resuscitation kind of thing?
No, no, no. In the injuries of strains and sprains, rest, ice
Yeah.
compression, elevation
Yeah,
बोला जाता
that's
है.
right. That's right. This we do it for the minor part. Like rest would
Yeah.
help. Ice packing will reduce the pain and temperature, so bleeding and other part would be less. So that is there. That is there. But
Okay.
usually you do things, and also if you see the extent of the injury is high, the risk of fractures there, you must reach to the hospital, call an ambulance in time bef-
Yes,
before doing
yes.
all
So
these
here
things
I
so
would,
that
yeah, we will take up accidents and injuries which are grievous in nature, trauma in nature on the roads in a while. But before that, there's one question on YouTube here. Appu ji पूछ रहे Appu Alange. Good morning, sir. What is the first aid when the snakes bite? Snake bite के लिए क्या कर सकते हैं?
okay, so snake bite obviously used to happen in India, in many parts of India, more common in the rural area. So depending upon, we do not know the snake whether it was that poisonous or not. Depending upon the snake type, we need to see the manifestation, what's happening to the patient. That is important. So first would be initial approach should be once you see the snake bite, the you see the person, you assess the person, that you have to see whether the person is breathing normally, whether he's conscious, he's breathing normally, how is his breathing, the airway is okay, there's no much secretions, and then how is overall the pulses or what you feel is okay. If you feel he's relatively stable, conscious, everything, so he should be shifted immediately to the hospital at the earliest. But if you feel there is a things like that, he's not breathing, he's drowsy, he's not breathing, then depending upon the status, like somebody who's unresponsive, you have to check for the carotid pulse, you have to check for the breathing, you can see the chest movement. If these things are not there, you have to do a cardiopulmonary resuscitation. Depending upon if somebody who knows the basic life support, where we need to give the thumping of the chest, that is 120 thumping per minute, and that is the simple thing, we have keep it 30 thumping and 2 rescue breathing. So these to be started, and before starting, you judge somebody who has a snake bite, suspected snake bite, and unconscious. Immediately, you put a call on the medical help. That is ambulance, could be some paramedics or somebody should be. You should start
Yeah.
initiate that and the medical help both.
The two important things that you have mentioned here. One, I will come back to the giving the CPR or pulmonary no thumping thing. I'll come back to that. As far as I remember, in my childhood days in the first aid, स्नेक बाइट जब होता है आइडेंटिफाई होने के बाद उसके ऊपर टाइप करो एंड देन यू
No,
रीच आउट टू हेल्प एंड bleed it
right.
out for will that help? Is that
That
still a practice?
is no longer medically valid. So it doesn't help
Oh,
anything. What you do if there's some local wound that needs to be cleaned with the water, and there's no role of tying or anything on that part. So medically, that is absolutely not recommended. Obviously, if
so
it has a large wound,
so
that
it's
has to be
important to update your skills जो हमने पढ़ा है almost 30 years ago
yes,
that might not be
yes,
valid today जो हमने सुना है या so we need to keep ourselves updated. So the old rule of tying above the wound and then washing it out is not important right now.
So washing of wound with the dirt, because a snake bite can add on many things. Like somebody can have a tetanus after that, or something, some other injuries because of the contamination from the wound.
Ji.
So a cleaning and basic assessment, because it could be a neurotoxic snake, it could be a cardiotoxic, which can cause immediate problem to the person. So the assessment of conscious level,
Symptom.
airway, breathing, and then pulses are very important and accordingly to be tackled. And obviously, if
Just
you
to
have some serious issues like that, you must call a medical help or ambulance.
यस डॉक्टर। डॉक्टर आपने जो बोला है कि वन कार्डियो हो सकता है, टू एवे ब्रीदिंग पल्मोनरी हो सकता है, थ्री जैसे बोला सबकॉन्शियस अनकॉन्शियस भी हो सकते हैं, सो न्यूरो भी हो सकते हैं। तो आइडेंटिफाइंग these symptoms and how long do you think that we what's the action time, कितना टाइम मिलेगा?
Usually, it depends upon the severity of the snake bite, the site of the bite, and like how poisonous was the snake and how much amount of bite happened. So it depends upon all
Yeah,
those things. It's difficult to
the
predict which
same thing
snake.
applies to, oh,
Yeah, both
does
both
the
are
same
the
thing
same.
apply to scorpions or any other poisonous insect bites?
Sorry,
Does the same thing apply to scorpions or any other poisonous insects?
all the poisonous, like all those bites are the same. They have to be
Okay,
managed in the same way.
done.
Obviously, in
Great,
hospital management would differ according to the patient's overall condition, but as far the first aid is concerned, it's the same.
done. So, quickly, next question that I would want to take up is a registered users question. Hamda Said, who is a Said, the 25-year-old female, how do we decide which wound or injury to be covered and which ones to be kept open? कब प्लास्टर कर सकते हैं, कब नहीं?
Okay. See, medically, what we see depending upon what kind of wound it is. Normally, most of the wound would do better if we cover it properly. Here, as a first aid with wounds, what we are having some cut, sharp cuts, or injuries, bruises, and all those stuff, it should be clean, washed. You can put some local antibiotic or antiseptic, and it would always be better to cover it because superficial injury, dust, and other contamination would create a negative impact. So, covering with a clean bandage would be a better option.
Okay,
So most of
great.
the wound
So it's
should be covered. Medically, it should be
yeah.
covered.
Great. So next question is also from a registered user's question. How about pesticide poisoning and the first aid? See, this is not just a farm scenario. Pesticides तो भी हमारे यहाँ cockroaches के लिए या mosquitoes के लिए और lizards के लिए कहीं भी rats के लिए भी हो सकते हैं. So poisoning is something which we need to understand, and how immediately do we need to react? How do we react?
Okay, see, again, judging a person would be important. It depends how much a person has consumed the
Okay.
poison, how much is the exposure. Then, if you notice somebody who accidentally had a poison or something, those pesticides or anything like that. So you need to see one thing, whether the patient is conscious, talking well, is there any signs and symptoms of stress or anything started happening? How's the his breathing? Is he breathing well? Is there any vomiting? If somebody who loses consciousness keeps vomiting, all like everything will goes inside lungs and all that. So they usually choke. So these things
Okay.
are important. If you feel the impact of poisoning is serious, the person is not conscious, though he is breathing, so he can be like all those components of basic life support and recovery positioning. This is a typical position where you can keep a patient in a healthy time. Like he can
Okay.
lie down to one side, keeping the head up and like this and knee flex. We call it a recovery position where like even if somebody vomits, so that position will keep the trachea central and the breathing would be best, and even if somebody vomits or secretions, it will drool down. It He will not aspirate most of it. And
Correct.
obviously, if
Correct.
you just notice somebody who is unresponsive with suspected poisoning, medical help is important.
Yeah. Yeah. And
And in
again, judgment
yeah,
plays a major role, and timing also
right,
plays a very major role. तो घर में स्पेशली बच्चे होते हैं जो whatever comes in their hand put them in their mouth. So sometimes it becomes, you're not even aware of what must have been gone inside. तो अगर poisoning हुआ है and बच्चों में by mistake, you how do you identify that this is what are the symptoms that you'll understand from poisoning?
okay. First, you have to see the overall condition of the patient. One thing is, at times they take something which can physically obstruct the smaller 1 or 2 years kid. So choking and all that component you have to see. Is he not able to speak? Is he choking? Is not breathing that well? So you can think after taking something which might have stuck some solid like a tablet, a bigger tablet, some pesticide. The other thing would be once the like thing goes down, get absorbed and causes problem. So that is what we call the poisoning effect. So depending upon, you have to again here judge whether the kid or the person is conscious or not. Overall, he's breathing. As I told you, somebody who already had a big, suppose a we are getting a lot of naphthalenes ball and other things which
Yes,
might
yes, yes.
physically choke the infant or kid
Very.
1 or 2 years might get choked and create problem. That could be only physical presence of that thing can cause without poisoning. So
Yeah,
the
yeah.
two components has to be checked in for the especially the 1 or 2 years kids. The physical obstruction, that what we call choking, and the other thing is once somebody swallowed it and it gets absorbed. So you need to see how's the patient, how's
Yeah,
the
yeah.
kid, is
Symptoms.
he vomiting, yeah, overall his general condition, whether he's breathing well or not. And obviously the moment you feel, and for the kids I would always say it's better to ring the hospital first and try to manage this and go and finally
Absolutely.
check the because a lot of
Yes,
delayed effects of this poisoning are
absolutely. And then, as far as I remember earlier, we were told कि उनको upside down करो, उल्टा करो, or pat the back for any
there.
choking
Yeah, that
instances.
that
Is it
that
still
that
valid?
would be something for choking, something
Huh.
obstructing, so you can do those thumping procedure in the chest, somebody who's little on a higher age, and the abdomen, and the kids can be done like that. That is for something stuck there, so that can be done.
So for
Inducing
choking that,
vomiting and all, yeah,
huh.
inducing vomiting and all those things, it's not going to help much. It's not recommended now. Like you put a finger in the posterior pharyngeal or induced vomiting, that doesn't help much.
And salt
So
water vomiting and all also
it's not
doesn't help.
recommended that.
Uh,
Right.
So reach out, immediate attention, medical help अगर ज़रूरत लगता है, then immediately आप 1066, 102, 108 call कीजिए और make sure that you have enough medical attention handy. Next question, doctor, I would want to take up is Mr. Maheshwara. Doctor, in case of large chunk of food bolus stuck in the middle or one third of the esophagus, how to make it glide down, and if there is a breathing impairment while this is happening, how to manage it?
Uh, well, that is difficult, and that's as I told you. Normally, what happens? These things doesn't happen in a person who's little adult and all that until somebody who has a very weird food, some non-veg stuff which got stuck or something like that, or somebody who has some medical issues like somebody post recovered stroke might have some difficulty in swallowing and all those things where things can create problem. Normally the mid of the esophagus very unlikely to have these things, but if yes, obviously first thing would be you need to judge how bad is the, like whether the airway is obstructed or not. That is important. Mid of the esophagus, as you mentioned, it's not going to create problem in the airway, but yes, in the upper part, suppose in the esophagus might overlap with the airway. So obviously with that part, if you're presuming it's choking, some stuff is there. The first, you need to check his general conscious level, because somebody who choked significantly, like 3 to 4 minutes of initial would be important, because brain cannot sustain a low or absent oxygen for more than 4 minutes. So initial judgment would be important, like somebody who's conscious, somebody who's breathing even with difficulty but breathing, and somebody whose pulses and things are okay, so that signifies the impact is not that much. But somebody who becomes unconscious, unresponsive, where you need to land up in doing a cardiopulmonary resuscitation and those kind of support, or
Okay.
those somebody who suspects some choking, obviously there's a few maneuvers. You make him lean forward, put
Mm-hmm.
pressure on the chest from the back, and you can give
Yes.
5 thumbs here, so that with the leaning forward, he might, things whatever is
Get it done.
obstructed might come back. And the other thing is like putting a pressure on the abdomen and doing the same procedure in the leaning part. So at times that help. Obviously,
So it's going to
would
be
you
thumping, rhythmic
thumping,
thumping,
yeah, thumping, rhythmic thumping
5 times.
on the chest side, and
And
an abdomen also can be tried. Yeah. So that might
okay.
pull, give a thrust, and the things might come out, which might have stuck there causing problem.
So, doctor, just to understand the procedure, it's not the thumping from the forward. Can it?
Mm,
It does it have to be पीछे से पकड़
yeah.
के करना? Does
Akarke,
one
then
have?
you, yeah, yeah. Those kind of thumping would help in a better way. And the person is leaning forward
Okay.
so that
Yeah.
anything comes
So
out
the patient is
with that.
leaning forward and जो पीछे से पकड़ रहा है वो अपने arms या बाहों से
आर्म
ऐसे
दोनों आर्म से पकड़
twist.
के, yeah. And for the same thing can be applied in the upper abdomen also to give that thumb.
Okay. Great. And any number like how CPR has a
Well, you
value?
can
Any
do
number?
like numbers, like you can do a 5 thumping at a go and see, that can be repeated till he becomes
Okay.
okay, or you get some
Wonderful.
medical help.
Thank you so much for that answer, doctor. Next question that I would want to ask is about, this is also a registered user's question. In case of the person in case a person is on blood thinners, what's the first aid to stop bleeding in a cut?
Okay, see, right. So whatever blood thinners you have, once you accidentally cut something, it's going to bleed for a much longer time. At times, even a smaller bleeds on a blood thinner, especially those the persons who have some coagulation disorders, those who have an artificial valve where we use strong blood thinner, we call it anticoagulants. So bleeding is on a much higher side. The other agents,
Hmm.
we have an antiplatelet like aspirin we use in the cardiac cases, stroke cases. They may not be that bad, but the anticoagulants are really the ones which needs to be tackled. The best thing is you need to bandage out, put a pressure and bandage out and stop bleeding. So that is the best way. And obviously, if you feel the cut is pretty major or it's a significant, so after doing all this basic bandaging, pressure once, you reach to the hospital or call ambulance and reach hospital. If you're in a
Yeah.
situation to go to the hospital because you have some peripheral cuts, put a proper bandage and all that, that has to be pressure bandage and you can reach the hospital. In
So
hospital,
pressure
we
is
have
the
a
magic word.
yeah, the pressure bandaging would be the magic word for these things. And the
Yes,
rest
doctor.
can be tackled in the hospital depending upon your anticoagulants. We have antidotes to stop bleeding if required, can be used.
Great. But then again, a person has to be aware that they are on a blood thinner and they
Yeah,
need to tell that
exactly.
the person or the
Right.
caregiver needs to give that information.
So the best thing would be if you do not know the person, like if things happening at somewhere, like in a public place or anything. If the person is in a position to ask, so you must ask, are you having any medical issue like diabetes or somebody who's on blood thinner? Usually in the Western world, they carry a card in those things. And we have a lot of events happening. Somebody who just become unresponsive, unconscious. There's a lot of fits also which is happening, can happen anywhere in the public places. So if somebody
Yes.
knows, so things become easier and certain.
Yeah. So a simple question here from a registered user. What creams or ointments would be more effective for treating cuts on the skin which are caused by the farming equipment?
Okay.
बोले तो
So the
डेली
idea
गार्डनिंग
is,
इट कुड बी
yeah,
abrasions और डेली गार्डनिंग करते हैं तो
right.
स्मॉल माइनर
So
होता है.
the first would be cleaning, definitely cleaning, and if you have a like cut and all that related with the gardening and all that, we also recommend after a good cleaning, stopping of the bleeding with the bandage and all that, somebody has to be like tetanus toxoid injections has to be given. Like if you regularly in the gardening and all that, where you're getting regular cuts, so every 5 or 10 years of tetanus toxoid boosting would be recommended from our side, because this garden or the those things where the mud and all that mixes with the blood can reduces the risk of
हाँ,
those infections, and we have a good vaccine if it's given in a proper way, so it's
great.
better to
So
take
in
that also.
continuation with the same topic, yeah. Sorry, doctor. Please
Yeah,
continue. Continue.
yeah, that what I told you, like after cleaning, bandaging, you must check your doctor whether you require a tetanus toxoid injection or not. So
All right. Yeah. So in continuation with the same tetanus question, Krishna ji पूछते हैं, up to what age ATT anti-tetanus injection is not required in children when they have fall injuries in legs and hands? Vaccination schedule में होता है, but till what age do they require and when should one get it done?
well, normally, initially, though, we have in their vaccination
Vac-
schedule and all that. But after that, even every 5 years, or those who are getting prone for all these, so it can be repeated every 5 or 10 years, or depending upon the injury. Somebody who's a major abrasion on the ground or major injury should take that time also.
Yes. Great. So next question is well, one quick question, doctor. Dog bites also. Dog bites also first aid की जरूरत पड़ती है.
Yes,
So
they
one
require
quick
first aid.
update
Yeah.
on the, yeah.
Yeah. So, depending upon the bite, that is important, right? If the bite is major, it's bleeding and all that. So, first initial tackling to be done. Like one is the cleaning of the wound is important, right? And then putting a bandage and then reaching a hospital for the
Yeah.
further support, and giving a injections for these things that
Yeah.
what we have. Uh, Immunoglobulins or Rabipur depending upon the extent of the damage and the tetanus. Apart
Yeah.
from
Yeah.
seeing the
Yeah. I
wound
thought
and
it.
if anything else is required is important, right?
So then comes the ARV and other the anti-rabies
Yeah,
vaccine. Once you reach the
right.
medical
So once you
then
reach the hospital, they
immediately.
will see the wound, whether you require immunoglobulins or not, or just only vaccination plus other
Yeah.
supports for the injury part, so that
Right.
they will judge.
Next question is also from a registered user. What is the first aid for a nosebleed in children?
Okay. So usually nosebleeds are common in children, even in adults it happens. So the first would
Yeah.
be to sit and clench the nose tightly for 5 to 10 minutes and ask him to breathe through the mouth. So putting a pressure would be important thing, and not to blow the nose and fiddle with the nose. Usually most of the time in children, dryness, crust, uh, if accidentally taken, or somebody who blows the nose a lot can cause epistaxis. But most of the time, if you pressure the nose and put the pressure for 5 to 10 minutes and ask to, like this, both the
Huh,
sides,
huh.
ask them to breathe through the mouth, yeah. So that uh, stops the bleeding. And obviously, you
Yeah.
have time, and if you feel the bleeding is still there, you need to reach to the hospital. Those persons who are on blood thinners and who are anticoagulants, they have those kind of bleeding from the nose and all that. After doing the same thing, they should immediately reach to the hospital. They may require some and other
Yeah. Other
antidote for
medical.
the anticoagulants and all that, right? Depending
Yes,
upon the
doctor.
bleeding and hemodynamic
Yeah.
status of that.
Yeah. Anmol Ratan Singh ji, thank you so much for participating. And he has mentioned a very important point, that is कि we should all implement safety first. First aid तो बाद में. But safety as a priority थोड़ा कम ही है हमारे country में. So I think
That's
that's
right.
more.
See, very true. That what we say, prevention is better than cure, right? Obviously,
Very much.
if you take a proper care, proper way, like if you have a wet floor, it should be properly marked. So the person should not enter in that area, or if entering, so he should be aware he might
Correct.
slip down.
So
So he
safety
usually
always.
careful and all that. So
Correct.
obviously, safety is the priority. It should be always like prevention is always better than having a disease. So that I
Correct.
totally agree.
Okay, two important questions, doctor. That as I'm running short of time, I will take these questions and sharp. One
Sure.
is registered users question. Oxygen अगर drop होता है when the cylinder is not available in lung patients, what can one do?
Okay. See, depending upon, as you said, like somebody who had some accident and had a falling oxygen, so you can loosen the airway. That if he's having some clothes, some tie, something like that, you can loosen the area. And the second thing would be putting a extended position and a position which gives the maximum airway entry. And if there's any
Okay.
airway block or something, that has to be tackled, right?
Okay.
And if somebody who's not having a good breathing, or the other things, as I told you, like the conscious level, then airway, the breathing and circulation, that need to be supplemented with those cardiopulmonary
Yeah.
resuscitative measures.
Okay. अनमोल रतन जी जस्ट डॉक्टर साहब ने डॉग बाइट के बारे में बात किया है बट वन एडिशनल इन्फॉर्मेशन मे बी what are the consequences if someone takes the rabies injection 4 5 days after rather 24 hours?
Okay, you mean to say somebody who had a dog bite in the
Yes,
next
doctor.
24 hours is not in a position to take it and it took it after 4 days, right? Well,
Yes, doctor.
it's always recommended earliest the better. But suppose somebody, due to some reasons, not able to take, obviously the risk would be marginally higher. But even after 4 days, it's recommended if somebody is left, it should be given.
Okay, and I've been waiting for this question कि मैं देख रही हूँ कोई पूछेंगे नहीं. So here's Mr. Shiva, 24-year-old male, is asking first aid when a person loses a limb in an accident and unconscious. Two, what to do if somebody is unconscious after an accident. Three, what is CPR and how to perform it when a person gets a heart attack. So let's take some time here कि ये जो रोड साइड इमीडिएट अटेंशन वाले मेडिकल अटेंशन वाले एक्सीडेंट्स होते हैं तो हाउ डज वन इमीडिएटली रिएक्ट एंड रिस्पॉन्ड.
Okay. See, again, you have to first judge the magnitude of the accident. Suppose some two cars collide and there is a serious patient inside. Okay, so or some car hit somebody or something like that where the person is seriously injured. So you have to just first thing you saw it. If you feel the surroundings for you is comfortable, you then proceed. If you feel there is some burn or something going on, obviously it's not recommended for you to get land up in problems. So first the place is safe, and then you start. If you feel there is the magnitude of impact or whatever the injury has happened is serious, first before starting call ambulance or medical help immediately, right? And you
Yeah.
start assessing his conscious level, the airway, the ABC, what we call the breathing and the circulation. If you feel the person is not conscious, the pulse is not there, he's not breathing well, you need, if you know, need to start the basic CPR. We do it, and rescue breathing and cardiopulmonary resuscitation CPR. Until you have to do till the medical team arrives, right? But if you go somebody who's conscious, who's breathing well, you need to see from where is the bleeding happening. So if you have some clothes, something, you can tie up and stop the bleeding. If somebody who's vomiting and all those, you can ask him, and you need to see if there's a fracture or something like spinal fracture, limb fracture, major fracture. So limb has to be in a kept in a proper position, and he should
Stable.
not be mobilized much, right?
Hmm, hmm, hmm.
So depending upon his overall condition needs to be taken, and the
Yeah.
arrangement has to be made. You have to be little careful to call the ambulance. The medical team
Yeah.
comes and start a proper medical care
And for all
and
of
shifting.
this, preparedness is very important. And
Very important.
Sachinji right pointed out how to control emotions and fear in an accident, and response immediately नहीं आता है, freeze हो जाते हैं काफी लोग. So it's
That's true.
important to get
That's
all of this into. So thorough practice also will help, no, doctor?
definitely thorough practice, and we recommend the basic life support anybody can learn. It's a simple thing of giving a judging a person, then giving a cardiopulmonary simple resuscitation. We're not talking about intubation or other supports or a defibrillator use. There's a simple thumping and rescue breathing. So
Yeah.
it can help many. It can cause many wonders if you understand what is the simple ABC of all
Yes.
these things. So
Yeah.
you
So
can
very
help
important.
many.
Yeah, Shilpa, 40-year-old female, how can you identify the need for a CPR? And CPR के बारे में थोड़ा हमें बता दीजिए. How can one learn? Where can one learn?
Well, we have a lot of medical support systems where you can like you have a lot of things like giving a basic life support. You can see that on net also, Red Cross also providing a basic life support is like somebody you have to judge first whether somebody is conscious. Mostly those who are conscious, you have other parameters also. Somebody unresponsive, you have to check for the airway, whether the air is clear or not. Then you check for the pulse and check for just you have to check for the carotid pulse because this is the major pulse, and then see whether the lungs, the chest is moving or not. That signifies is breathing. You can listen whether, like,
Yeah.
when you breathe, you can hear. So those things can
Yes.
be checked. If you feel there's no pulse, the chest is not moving, straightforward you go for the cardiopulmonary resuscitation. Normally, for an adult, we use these thumb like this, putting on the
Okay.
chest, and we do significant thumping, like the chest should move at least 5 centimeters or more than 2 inches. The pressure has to be that good, and the numbers has to be 120 in a minute. So that to continue, right? And plus, you can give in between rescue breathing. You have to open the mouth, close the door, and put your mouth
If
and give a deep breathing.
breathe.
So that is
Yeah.
30 thumbs and two rescue breathing, 30
Okay.
compressions and two rescue breathing. That to continue till the medical team arrives and they take over with intubation and other BC shock. That is little technical, but that is for the medical staff or paramedics. But till then,
Yeah.
you can use that, the CPR pushing. That's
तो
basic.
डॉक्टर स्पेशली घर में अगर बात करते हैं तो अगर हार्ट अटैक किसी का हुआ है, ब्रेन स्ट्रोक किसी का हुआ है, such conditions, if the person is unconscious, will CPR come not in brain stroke but at least heart attack में किसी ने
See,
पूछा है यहाँ.
I just mentioned about the two conditions, like you said, stroke, right?
Yeah.
Normally, if you can detect at home, it is most of the time it happens at home. Like when you see somebody who had a, we call it fast for the stroke.
If AST,
Firstly,
हाँ.
at the face, is the face is deviated? Yes. Arms are
Feebleness,
not moving? Yes. S is the
yes,
speech, some defect in the speech.
blurry
If all these things happen rapidly
and
or
time.
very recently, so you presume it's a stroke. The time is important. You reach to the hospital. So the basics would be the same, right?
जी.
So suppose somebody who is a massive hemorrhage landed up in unconscious, so you need. again you go back to your CPR status,
Okay,
whether
okay.
he's
So heart attack में
breathing.
कैसे manage करते हैं? Once you
Heart
understand that
attack
it's
would be like somebody who has a chest pain, somebody who has a breathing difficulty, somebody who's already a known cardiac patient has angina. That again, one part of CPR would be the same. If somebody who's a cardiac arrhythmias and just become unresponsive, you need to tackle in a with the cardiopulmonary resuscitation. But those who are conscious, having pain, the control of pain, use of sorbitrate, and immediately reaching the hospital would be the best option. And the person has to
sorbitate.
be calmed down, and
Yeah.
physical activity has to be normalized. Should not walk, run. He should not climb the stairs. He has to be rested totally.
Yes, doctor. Very, very important. I think we all need to make sure that our what you call uh, all the first aid tips should be always reiterated,
Yeah,
thoroughly practiced, always on hand, so that we don't lose our calm in such situations and judge
that's
well.
right. That's true.
Yes.
That's true.
So, Doctor, thank you so much for these wonderful insights into first aid. Now, I would want you to give us some top tips in managing issues on the first hand. First aid kit top tips, please.
Okay, as I told you, first aid is totally dependent upon the situation, what kind of things are there. So it totally depends upon that. Somebody who you're suspecting stroke fast, you approach according to. And obviously, before starting any major, if you guess the event has happened, which are really major, you should call a medical help or a ambulance immediately and start doing all these things. The minor home problems, if you have a cut and all that, apart from cleaning, applying antiseptic, pressure bandage to reduce or stop bleeding is an important part. If there is some cardiac event, that has to be managed accordingly. If you have some other electrical shock or drowning, that has to be managed accordingly. So depending upon the situation, you need to act. And assessing the patient is important, like the conscious level, his breathing, his circulation, the pulses are felt, whether he's properly breathing or not breathing. Those things has to be judged and accordingly managed. Those who are sick, require cardiorespiratory support, should be given immediately.
Yes, doctor. Thank you, doctor. Wonderful session. This was very, very insightful. We thank you for this time on Sunday morning and wishing you a great year ahead.
Thank you, Lakshmi ji. Thanks a lot, and had a lovely time. And hope
Thank you,
people
doctor.
would understand it better. Thank you.
Yes, yes. Value of first aid is very important. That's the first call Dr. Kamal Ahmed ji has given. Thank you once again. Namaskar. So this is our session for today, and for all the viewers who have been watching, here are some coupons that you can use in Apollo 24/7 app. Download the app and you can use these. The first code that you can use is AskDoc 150, ASKDOC 150. You can consult top doctors from Apollo hospitals and get up to 150 rupees cashback on online doctor consultation. So this can be used on Apollo 24/7. And the next coupon that we are giving out is First 3, FIRST 3. And you can order medicines direct from Apollo, get 25% off on online medicine orders. This is valid on the first three the medicine orders above 1000 rupees value. Conditions do apply, of course. Do download Apollo 24/7. And now you can also order medicines on WhatsApp. But before that, let me give you the exclusive health hour coupon. HH247 is the coupon that you can use on Apollo 24/7 app to get up to 199 off on online consultation with Apollo doctors and up to 20% off on medicine orders as well. Use this in addition to the coupons which we shared earlier. And you can now order medicines or book tests at the convenience right from home, where just a call away. Apollo 24/7 is on 09355 247 247. You can call or WhatsApp on the number to avail the healthcare services, which are all available on 24/7. चलिए नेक्स्ट वीक, अगले हफ्ते हम बात करेंगे कब्ज के असरदार उपचार। ये एपिसोड हम हिंदी में करेंगे। जो भी हम हमारे व्यूअर्स हैं जो हिंदी में, वी वांटेड हिंदी एडवाइस। लास्ट टाइम हम बात कर रहे थे, लॉट ऑफ पीपल वांटेड इन हिंदी, सो दिस इज गोइंग टू बी एन एक्सक्लूसिव एपिसोड। हिंदी में बात करेंगे और हिंदी एपिसोड होगा 15 जनवरी संडे 11 बजे। ज्वाइन हो जाइए एंड मोर डिटेल्स यू विल फाइंड इन अपोलो 24/7 इंस्टाग्राम और फेसबुक पेज एज वेल। चलिए, थैंक यू सो मच ऑल ऑफ यू। प्लीज डू टेक केयर। फर्स्ट एड में फर्स्ट याद रखिए, द फर्स्ट रेस्पॉन्स शुड बी, द इमरजेंसी रेस्पॉन्स शुड बी वेरी वेरी कैलकुलेटेड. Call 1066 in case you require emergency services. Thank you once again. Stay healthy.